So cheers, everyone, and welcome to yet another Monday and the sip for the day. I thought I'll share this time a little more information on something that is very dear to us and is always straightening us up, our spine, because on the 16th of October was World Spine Day. And it is something that we have to take care of at all times. In fact, I say right from childhood, we need to train children on how to take care of your spine because that is as we age, as the pressure increases with gravity, it affects our spine and slowly it builds up to later on you'll get backaches of various kinds and can cause various kinds of spinal injury. We need to take care of our spine. Our spine is again something we often neglect. It has around 33 vertebrae, and it's very interesting. It is S-shaped, and the reason why it is S-shaped is because it has to absorb the shocks. It's like a shock absorber. If it was straight, then the spines will impact each other and it cause more injury. So it's S-shaped because of that. So it'll absorb the shocks. But sometimes if the injury is a bit too much, it does affect the spine. So here are a few tips that you have to keep in mind. And I thought I'll come up with the word spine care to help you remember what are those tips that you need to keep in mind to keep your spine safe and support the spine, because that is the theme this year. Support your spine. S tells us about strengthening your core muscles. S also tells us about stretching. This is what Babita keeps telling us to do. Stretching exercise is important for your spine. Strengthen your core muscles. It's not only the muscles of the spine, but also the muscles of the abdomen, which actually form the core muscles that support the spine. So very often when you go to a doctor tells you to do exercises of the abdomen. You wonder, no, doctor, it's my back that's the problem. Why are you telling me to do exercise of the abdomen? Because abdominal muscles actually support the spine. So you need to do exercise of what we call the core muscles that support the spine and do it regularly. P tells us about practice good posture at all times. When you're sitting now and watching this, you have to make sure that you're in the right position, right posture. Don't slump yourself in a chair. Don't be sleeping somewhere. Don't bend yourself and look at the screen because that may be easier for you to do. You need to make sure that your spine is erect at all times. You're sitting on the right position and a right kind of a comfortable kind of a chair that is designed to protect your spine. And that brings me to I. I is invest in ergonomically designed furniture. That's a big word, but that's what tells us that furniture needs to be designed for your height, especially people who are working on the computer at all times, doing sitting jobs all the time. The chair has to be designed for you. The height of your table has to be designed for you. The way you're looking at the screen on the computer has to be tilted such that makes it easier for you. You're not causing any stress on your neck or stress on your spine. So it has to be ergonomically designed. To spend some time to see that what you're using, what is sitting, and what the furniture around you is ergonomically designed. So invest in that. SPIN. Never lift heavy objects improperly. This is a mistake a lot of people do. They'll come with low backache to us, and if you ask them, "Did you do something?" Yes, I did lift up something. I tried to lift up a chair or a table or a bed or something very heavy. You can lift up heavy objects, but there's a technique in which you have to lift up heavy objects. So never bend your spine. Instead, bend your knees if you're trying to do that. Sometimes when we meet, I'll probably demonstrate how we can do that. But keep in mind that techniques in which you can lift up heavy objects. If it is too heavy, don't do it. But if it's like, okay, you can do it, then make sure you use the right technique. And when you're trying to lift up heavy objects, small mistakes like this injure the spine, and then you're sitting there for the next 3 months trying to undo that kind of an injury, address that injury. E is tell you to engage in regular activity, regular exercises. Engage in regular exercises, not only when you're having a problem, you're going to do some exercise. No, regularly, as we tell you in the Memory Cafe, every day, spend some time in doing exercises. When you're doing exercises, exercise like yoga, very good. Stretching plus strengthening, everything put together. That too, you don't have to go far away to do it. You can do it at the comfort of your own house. And this is what Babita has been telling you every now and then. So invest in exercise, invest in strengthening your muscles. So that tells us about spine care, spine care. C tells us about control your weight, because your spine, unlike animals who have a horizontal spine, all our weight is borne by the spine. So if you're going to be heavy, it's going to be a lot of pressure on the spine to keep you erect and help you walk. So if you reduce your weight, it makes it easier for the spine. So reduced weight is something that we always tell you. Check your body mass index, and if it is high, if you're obese or overweight, try to address that and try to reduce your weight. And there are techniques by which you can reduce your weight, which we tell you time and again. So reduce your weight, control your weight. The first thing that you keep in mind. A is avoid smoking. What smoking does is it constricts our blood vessels. This is atherosclerosis. Less blood supply to various organs. It causes problems in the heart, causes problems in the brain, also causes problems in the spine because there's less blood going to the spine, less nutrition to the spine, as a result of which there is more problems taking place in the spine, osteoporosis, etc., which we need to address. And so avoid smoking. Smoking is one of the factors that causes a lot of problem to our spine as well. R tells us about resting in proper sleeping position. The sleep on your back. If you're not used to sleeping on the back, you want to sleep on the side, but make sure you need to be conscious of the fact that your spine is aligned properly. So if you're using a pillow, sometimes people say, should I use a pillow? Should I not use a pillow? Should I use a thick pillow, a thin pillow? All depends on how you're sleeping, such that your spine is aligned properly. So if you're sleeping on the side, you may have to use a little thicker pillow because you need to align the spine a little higher up. If you're sleeping on the back, you can use a thinner pillow, but keep in mind, be conscious of the fact that you need to align your spine appropriately. Use a proper mattress that is going to ensure the curvature of your spine. If the spine is not flat, it's not straight, it is S-shaped, I told you. So that shape has to be maintained, because if that is pressurized, then that causes a problem. We sleep for around 7 to 8 hours. So you can't have pressure on the spine for 7 to 8 hours. You need to make sure that there's something that supports the spine. And E of care tells us about trying to be in an environment that is safe for you. So slipping and falling, having accidents that can injure the spine can cause a problem. So make sure you're always there in an environment that is safe for your spine and you can keep yourself healthy. So remember the word spine care and all that I told you in this tip to keep your spine healthy and support your spine at all times. Cheers.
Even while kneeling on the bench, you have to sit and kneel, and then when you get up, sit and get up.
Yes, yes. So you get signs that something is going wrong. When there's a little bit of pain and discomfort, it means the spine is getting affected. So be aware of these signs and don't push yourself too much. Be slow and understand. Make it a habit. It should be subconsciously you do the right position, especially while kneeling, getting up, sitting, standing. If you don't have a kneeler, it's okay not to kneel. You can stand whenever you have to instead of kneeling. So keep all those things in mind, because that's going to support your spine. And it's important for us to support our spine at all points of time.
Thank you very much, Doctor. That was such a lovely sip. And we'll remember always to take care of our spine, which is a backbone of ourselves.
Yes,
so
true.
It's so good. Thank you very, very much.
Most welcome.